You're listening to There's a Better Way, smart talk on healthcare and technology. If you're up for energizing and story-driven conversations with national healthcare leaders driving industry innovation across the country, then you are in the right place. What if the single most important shift in healthcare isn't a new drug, a new device, or even a new policy? What if it's the moment a patient finally gets to own their own story? As we'll hear, today's guest has lived that question from almost every angle. Amy Gleason is the newly appointed head of the CMS Office of Health Technology and Products, a first-of-its-kind center designed to bring unified strategic leadership to healthcare technology across Medicare, Medicaid, and beyond. She is also the administrator of the U.S. Department of Government Efficiency. Amy is leading one of the most ambitious efforts I've seen in my career to break down the data silos that have defined American healthcare for decades. Today, Amy and I talk about the CMS Health Tech Ecosystem, what it really takes to build trust across a fragmented industry, and why the technology moment we're in right now might be the one that finally tips the scales for patients. This is There's a Better Way. I'm your host, Melanie Marcus, and we're about to hear from Amy Gleason. Welcome to the show, Amy. I'm so happy to have you here with us today.
Thanks so much for having me.
Well, let's start with, I hear there are some changes at CMS in terms of how it's structured and how it's working. Can you share some of that with us?
So we announced that we're creating a new department at CMS, and it's called the Office of Health Technology and Products. And it's a way to really create a center of gravity at CMS for technology. We're at this amazing place where technology has all this capability. And traditionally at CMS and at many places in the government, it's split into all the different centers. So you have a tech group that's working on Medicare and a tech group that's working on Medicaid and et cetera. And so this is bringing those things together so that there can be a strategic plan on how we take advantage of all the momentum in technology and deploy that from one place instead of having it siloed in different groups. So I'm very excited to be leading that group.
Wow, that is exciting. When we think about what, a better way in healthcare, what does it look like for a typical experience for patients and families?
It's really challenging to be a patient. It's not something that is easy, and it's not easy to be a caregiver either. And so I think a better way is that patients get everything that they need and the time that makes sense for them and in the way that makes sense for them. So some patients like to go in person and sit in front of a doctor and talk to them. Other patients, like my daughter, who's 27, wants to just get information quickly, maybe through an app. And so I think we need to give people access that's available anytime they need it in the way they want it. And it needs to follow them without requiring faxes and paper like we have. We should be adjusting to the rest of the way the rest of the world works and have modern technology for patients and easy access to services.
So you gave a TED Talk back in 2020 about your daughter's experience as a patient and your experience as a caregiver. You described how that shaped your path and reshaped how you see the healthcare system. Can you take us to one moment from that experience where you thought, this should not be this hard? What is happening?
Yes, it's a moment that I definitely will never forget. It's what shaped my life in a very different way than it had been before. Morgan had been having a lot of trouble really with her health in general, but we'd been on this journey trying to figure out what was wrong with her. And she was 11. She was a competitive gymnast, and she couldn't stand up off the floor, couldn't walk up the stairs. She had just all these weird issues. And they finally decided to do a skin biopsy, kind of, we thought, a little bit unrelated to all the major issues that she had. They just did a punch biopsy on her knee and her elbow. But somehow I knew that this was going to give us an answer, and I knew it was going to be serious. You try to tell yourself stories in your head, that maybe it's just something simple, or maybe this, won't really show anything important. And so they did the biopsy. They told us it would be a week for the results, which I don't know if you've ever waited for biopsy results when you're really worried about something, but a week is an eternity. Every minute you're thinking about this and worrying about it. You can't get it out of your head. And so we finally get to the day where we're going to get the results, and it's almost an hour drive to the doctor's appointment. So I take my 11-year-old child, we get in the car, we drive there, we sit in the waiting room for quite a while. We go to the exam room and sit for quite a while. And then someone comes in and says, we're going to have to reschedule you because the results didn't come in yet. Okay. And so I'm like, can you call and try to see if they can get them? They're like, we already did. We don't have them. So just go home and we'll see you on Monday. This was a Friday. So, of course, this is now a whole nother weekend of waiting. And so we get in the car and we're about halfway back home. And we get a phone call from the doctor's office and they say, oh, we just got your results. Can you come back? And so now we're, in this anxiety driven car ride back to the doctor's office. And they did at least put us straight back into the room instead of the waiting game all over again. But a doctor that we'd never met came into the room and she tells me that Morgan has a life threatening disease. And she has tears in her eyes as she's telling us this. And of course, Morgan is watching me to see how I react. And she's already heard life threatening, which when you're 11 is a pretty scary term to hear. But she also sees that the doctor literally has tears in her eyes. They tell us we should go see her pediatrician and they should start her on steroids, but they don't want to do the dosing because, they want her pediatrician to see her. And so I immediately get in the car and I'm texting or calling my friend who's a doctor. And I'm like, can you please look up everything you can find about this? Because I don't know what we've just walked into. And so we drive to the pediatrician's office. And before I go in, I call him and he gives me like the brief update of what he's found looking it up. But it's a rare disease, juvenile dermatomyositis. There's not very many people with it. So there wasn't a whole lot of information he could tell me. So we go into the pediatrician's office and she is looking up this disease like through books and she's Googling it. And so she is trying to figure out how to help us. And so she says, the other thing they told us is we need to get an MRI that day before she starts the steroids. And so they gave us an order and send us on our merry way to get an MRI. So we call the radiology place and they say, oh, we can see you next week. It's like, no, we have to have this today. And so we go, show up, they work us in, and we get there and they're like, oh, for this type of MRI, we don't have the right equipment. You have to go to a different location. So we'll have to schedule you for next week. I'm a little emotional at this point, and I kind of get them to pay attention and say, like, this is super important. We have to do this today. So we drove over an hour to a different place where they did the MRI. And then, we go home, we get her prescription. She starts the prescription. And they had drawn a bunch of lab work. And at 2 a.m, our phone rings and they call to tell us that she's having a heart attack, they think, and that we should go straight to the emergency room. And I'm like, what? You got this from her lab results like today? And they said, yes. And so I start asking more questions and I realize it's just the inflammation from this disease is so profound that it's showing up in one of the markers, and realize that we probably don't need to go to the hospital. But most people probably would have never known that. I called her pediatrician and we didn't go to the hospital, but it was quite an alarming call to get. So this was our first 24 hours into this disease, which you can see was 100% not anything about the patient. We had to wait. We didn't get very good information about the diagnosis, driving a long way, having to book our own MRIs, figuring that out, navigating it, calling the insurance, and then getting scary information in the middle of the night was definitely not a very patient-centered way to get welcomed into this rare disease world. And it's been a journey ever since then, but that was definitely the moment that I realized how hard it is to be a patient and caregiver in our health system.
Oh my goodness. That piece of your story I hadn't heard. I can't even imagine as a mom myself. I can't imagine. So in that moment, what information or support did you need? What could have been different?
I mean, first of all, I think waiting a week for biopsies is pretty outdated, even back then. And so I think we should have much faster diagnostics. Of course, we want accurate results, but using the technology we have to deliver them much quicker. I also think you don't necessarily need to make someone drive almost an hour to get results. I think you can do a lot of this over the phone. I would much rather get something over the phone faster than wait for an appointment or have to drive in. And I think a lot of people also would feel that way. Other people, like my dad, probably want to be in person with someone. I think it would have been great if we hadn't had to bounce all over town that day to see so many different people. If the dermatologist that did the biopsy had just called her pediatrician and figured out the dosing so that we didn't have to do a double hop, if they could have, drawn the blood right then instead of sending us somewhere else to another lab, if they had made the appointment and figured out which machine was right for him or I, and they had done the prior authorization work instead of me calling the insurance. And in today's world, where I can book an Uber or a Waymo on my phone, like it seems like we should be able to do a lot of this through technology without even the offices having to do all of this work. So I think we really just need to take advantage of the technology we have and rethink the experience from the ground up and not just try to put technology into what we've known forever, but instead reimagine the entire thing.
Let's think about that. Speaking, from your background as a nurse, entrepreneur, technologist, caregiver, all of the above, where is technology helping patients the most right now? Do you see glimmers?
Yes, I actually do. I happened to stumble upon a patient group the day that Morgan was diagnosed because I started reading every page of Google and I found this nonprofit called CureJM that had a message board. That day, I posted on the message board, and a mom whose daughter had had the same disease for 13 years called me and said, "Get a piece of paper. I'm going to tell you everything you need to know." And she sent us to the world expert in Chicago, gave me her email address, who, by the way, she actually answered the email on that exact night, Friday night, which is shocking. Immediately, I felt like I had answers that I had not gotten through the medical system, but I had gotten it from other families. So I think that's a key part of ways that technology can really help connect people. When there's only about 2,000 kids with this disease in the US, being able to find people that can help you understand what's going to happen very easily is great. Obviously, the biggest thing is AI is really just changing the world, but especially healthcare. It now gives patients a way to really understand what's happening with their body and their issues. I've seen it firsthand with Morgan. She takes 21 pills a day and gets 2 infusions a month, but she also has this huge as needed bag of drugs that she has to try to figure out which one to take when. And she's really started using her wearable devices plus her medical records in conversational AI and asking it, what should I do? I'm feeling this way. And sometimes it tells her to take the medication, and sometimes it tells her maybe she needs rest or she needs to eat a banana or something different that she wouldn't have thought of. And so I think from an everyday support perspective, that's just going to change the way that we experience healthcare and the immediate access.
I've seen the impact of AI myself in my personal life. It's pretty phenomenal. What conventional thinking about healthcare technology do you believe still needs to change the most?
Oh, I think the biggest thing probably is that we need to stop holding on to the data in silos, and we need to make sure that everyone that needs it has it. Starting with the patient, it should be something that the patient just has easy access to in the technology or a way that they choose to have that, whether that's a paper chart or whether that's in an app. But I think the data and the lack of people being able to get easy access to it has really been what slowed innovation in healthcare. And we've built a whole system around this siloed data. That's what I believe made Morgan get a delayed diagnosis for a year and 3 months. I think that's what slows people down from figuring out what to do because they don't remember all their history. They don't have the, fortune to have all of their records. And so they're dealing with pieces and parts of information. And doctors that are trying to treat them often have about 40% of the patient's chart and have to rely on the patient's memory.
Why is it still so hard for health information to follow a person when they move away, when they change doctors, when they have multiple doctors, when they have multiple health settings? Why is it so hard?
Yes, it's definitely not a technology problem anymore. This is really a cultural problem. Last year, we did an RFI actually asking the industry, why isn't this working? We've done regulation for 20 years. We've done $30 billion of incentive payments. We've had information blocking and created HIEs and TEFCA QHINs. And we've done all of this stuff, but still, you can find pockets of success, but by and large, the data just doesn't move the way it should. And so I think the main thing is that the industry has been put in a very cautious space through a lot of misinterpretation and myths that go around, especially around HIPAA. If you're a patient, you hear that as an excuse for the reason you cannot do anything in healthcare. Everything you ask is like, oh, I can't do that because of HIPAA. And I think it's mainly just misperception and misunderstandings there. But it's created this huge amount of distrust in the industry and a worry about who else is going to get the information, as well as people hoarding the data in their silos and being scared to share it. And so I think that the biggest things we need to do are improve trust. That's some of the work we're doing at CMS. A lot of that is around identity and being able for a patient to prove who they say they are through modern technology. That's like the NIST standard, IL2, like Clear or ID.me, and letting patients verify they are who they say they are so you can trust that. And the same with providers. I'm sure you've been following all of the fraud work that we've also been doing in the government, especially at CMS. And we don't even have providers verify their identity today. And so that's the other piece we're doing with the provider directory. And then I think we need to rethink the way that we frame trust. So as an application, how do we know that that application is actually authorized to get information for that provider in that purpose of use in a way that other people can trust it and know that it's safe?
Trust is a big theme, something we spend a lot of time thinking about here at SureScripts for all the same reasons. So CMS's theme is independence from paper, fax, clipboard-based care, part of the CMS pledge. Hundreds of healthcare organizations signed, including SureScripts in 2025. Can you talk about the pledge in terms of trust?
After we had done this request for information and trying to understand what these real problems were, we decided to launch the CMS Health Tech Ecosystem in our effort to kill the clipboard and axe the fax. And so we had an event at the White House with the president, Secretary Kennedy, Dr. Oz, and myself. And we got about those 60 companies to start. And really the idea was to lay down a vision and say, we can't regulate our way to success here. We really need to get all of the stakeholders to work together and try to move quickly in a world where technology moves. And so we basically laid out a vision and said, in 1 year, we want to make a ton of progress in this. And we want to put patients first. We want patients to get their information, but we also wanted to try to solve some of the problems around trust and delegation that we heard around providers, and also get payers into the mix because by and large, they haven't been able to participate in the efforts very much to date. And we had an initial goal of March 31st to have a minimum viable product. And then July 4th, America's 250th birthday, to really free the data and to have modern tech tools for patients. So since then, we have over 800 companies that have joined us. And we have a Slack that's set up that people can come in and work together. And we will regularly have calls on different working topics, things like identity and trust and how do networks communicate with each other? How do we make sure patient apps are trusted and are safe for patients to use and that they understand how their data is being used? These very important topics. We will have the networks that are in there. We have payers, providers, the electronic health records. We have innovative, new companies that are just starting out. We have big tech companies in there. We have patients and their caregivers. We have all the stakeholders in one single place. And so that way you get to hear all the perspectives and try to make sure that you're solving the problem, not just in a way that it solves for a provider per se, but also for a patient, also for a payer, also for a family caregiver that's trying to take care of a loved one. And so I think it's been pretty incredible, the breakthroughs that we've had. On April 9th, we had 120 companies go into production, and we have a Medicare app library where you can see the first apps that are verified by CMS to be in that library. They've gone through a privacy and security review through either Direct Trust or through the Dime seal. And all of that is saying that they're pledging to meet the privacy and security plans, and they've been validated through a certification process for that. And those are now live and available to patients, with many more of those apps coming.
That's fantastic. So as you talk, I'm thinking, collaboration in healthcare and solving these big issues is the key. We've explored it many, many times on this podcast over the last 5 years. And it occurs to me that you put collaboration on the superhighway. So what are some of the successes and some of the challenges in collaboration in this way?
Some of the major successes, I think, are that Most of the big companies and the small startups that pledged originally last July 4th have delivered on their commitment. So that is super exciting. And we have a ton of patient apps that are now coming out. So the main things are things like Kill the Clipboard, which is a patient can verify their identity one time using either ID.me or Clear. And they can click one button and say, I would like my data, please. And it can go through this series of networks we call CMS-aligned networks and bring their data back to the app that they choose. And then they can use a QR code to share that information with their provider, either in person or online, if they're answering an online questionnaire, for example. And so that's a really empowering thing. But then the second thing of that is once you have that information, then you can use conversational AI on top of that. So instead of a patient having to know the right questions to ask an AI chat or remember their history or the right information needed, it has their medical records. And so an example of this, my daughter put her records into ChatGPT. She was declined for a clinical trial for CAR T, and she was declined because she has overlap of ulcerative colitis. And they didn't want her to go off of her medications because it could be too risky for her colitis. And so she was frustrated. And instead of, trying a typical way, she's 27, she said, find me another clinical trial to her ChatGPT. And it said, actually, I don't think you need another clinical trial because I think you're eligible for that one because I don't think you have ulcerative colitis. And it had read her 16 years of medical records and all of the biopsies and realized that she has a slight deviation called microscopic lymphocytic colitis, which is much less aggressive. And so it's less risky to take her off of her meds. And it's not an exclusion for the CAR T trial. I think that's really the power is people are always worried that patients won't know the right questions or right context. But I think the speed the AI is moving, it can really give you information without you really knowing what to ask. And the last category of our apps is really diabetes and obesity, which is also using that same medical records piece and helping you to customize personalized advice to improve either your treatment or prevention of diabetes and obesity. So those are the three main use cases that are anchoring this ecosystem that are huge wins for patients.
Wow, that's exciting, and I'm going to go look into it myself. So, what are the challenges in this incredible collaboration experiment?
Oh, the challenges are many. It's like pushing a snowball uphill. The biggest challenges I said are really trust. And so that's the biggest advantage of having all of the stakeholders together in one place that they can hear each other's perspective. I think the conversations are really good, but change is just hard, and especially in healthcare. So getting, these organizations that are very large and are very protective of their patients and their data and their intellectual property and getting them to share that with others who are their competitors on these calls and to just move at the speed we're wanting people to move, for companies to adapt to the speed and the changing movement of this that we've had over the year has been a big challenge. But really, I'd say the biggest challenge still all boils down to trust. And we have to find ways to help people trust each other and feel confident that they're doing the right thing on behalf of patients.
So, can you talk about the role of TEFCA and QHINs with the CMS-aligned networks?
Yeah, so all of the QHINs are participating in the health tech ecosystem as CMS-aligned networks. They've all pledged to join and they're participating in these work groups. And so I think the idea of this is not in competition with TEFCA, which is a question I get a lot. I see our job is to really get people to try things and to move them into production. I think we spend a lot of time in healthcare in these little work committees of small groups of people, and we test things, but it's usually like a fake patient sharing data back and forth. And I think that's part of what takes so long is because we use those things, we write specs, people go implement them, and then they say, this doesn't exactly work. And I saw this last time I was here. I led the CMS data at the point of care project, which is giving providers claims data from CMS to use at the point of care. And we were the first implementer of bulk fire. And so when we went to implement that, we quickly realized that the spec actually didn't support a lot of what we needed to do. And then you're kind of stuck in this dilemma of how do we do this quickly when this doesn't meet our needs? And so we both worked with the fire community, but also kind of implemented our own extensions, but documented it so that others could see what we did and grow. And then eventually it went back into the process and they made those changes in the spec. But it's hard to adapt quickly on the fly. So I think that's the biggest thing is we need to be able to have a way to take full things into production find what works, find the edge cases, adapt as you go. And then once we have it working in the market with most of the major players, then you can use TEFCA to come and bring the rest of the people up to raise that tide or raise the floor, as we say.
Thanks for that explanation. So one of the things that, as we're talking about independence and from the fax machine and paper is prior authorization. And right. Can you share a little bit of work that CMS has been doing lately? I know there's a lot of work happening here around prior authorization.
The prescription side is still coming along a little bit more, but for medical, we just kicked off a working group. And actually, just this last week, we had a listening session, a roundtable at HHS, where we had the major payers and providers who have signed this prior authorization pledge, which is our first new pledge we've added in the ecosystem since last July. And this is the same kind of thing. We're pairing up providers and payers and getting them to go live in production and then move that quickly through so we can find out what's working and what's not way ahead of the deadline. And so we've challenged them to go live with at least one pairing by October 1st and then with everyone by January 1st. And so we're really moving that along, but it's another great example to hash out the details together with all the stakeholders in the room. And we're just kind of running the same playbook for prior authorization.
You've said that data being available isn't the same thing as data being useful. As a caregiver, what's the gap between those two things?
Yes. So, I think people do a lot with patient portals, for example. And I have been trying to make sure that this access patients get is in a way that's easy for patient. Verify your identity, you click one button and get your data, not signing into all the patient portals. So my daughter has 51 patient portals that we know of. It's way too many places to go and remember usernames and passwords and get siloed information. So if you do go to those 51 patient portals, the data is maybe available. We often find that actually all the data is not there in the patient portal, but let's just assume for a minute that it is. Having that in all these different siloed pieces is not very useful. So that's the main thing we're trying to change with the ecosystem is to make that available and useful.
Well, it sounds like you're making some amazing progress there that we should all kind of take note of both professionally and personally. And so you also talk about, when you get information is just as important as whether you get it. Can you talk about that?
We have lots of patients we hear about in the community that they get a cancer diagnosis one day and they're trying to go see their new oncologist and the appointment gets canceled because the private provider doesn't have their medical records. And so that's a great example of the timing really mattering. They need that data when they need it right then so that somebody can start life-saving treatment for a serious cancer. And I've seen this happen personally to me, several people around us, and it's just not acceptable. I've taken Morgan to go see specialists and they say, we need you to get all your records before we can see you. And I've spent hundreds of dollars and time and energy driving to offices, sending faxes, trying to get them to give all the information and then assembling all of that and getting it to a specialist. And so it just shouldn't be this hard. It's got to be easier and you need to be able to get it in real time and be able to share it in real time.
Hard to disagree with any of this. This is like lived experience, personally, professionally, as a mom, as a caregiver, all of that. So let's talk about change management and leadership, because really, like that is a thread through this whole conversation. Change doesn't always come as quickly as we hope it will. So in healthcare, resistance to change is often framed as kind of a necessary risk aversion. You talked about that with HIPAA. How do you distinguish between healthy caution and inertia?
Yes, I think you can tell pretty quickly whether someone is trying to figure out whether they really want to protect someone or whether they're just putting up blockers and using caution to say what could go wrong instead of what could go right. So I like to remind people that not giving patients their data is more dangerous than maybe an incidental slip up where you might give the wrong information and one in a million patients or something. And so I think we have to stop being so worried about small things that could go wrong and realize that we're stopping great things from happening to people by keeping it from happening. I think we do need to make sure that there is security and privacy in play. Of course, this is people's health information. And you have people that feel very strongly on all sides of this. My daughter, who's 27, started talking about her healthcare when she was 15 publicly. because she really wants a cure and she wants people to know how hard it is to be a patient and that there needs to be change. She's put her information everywhere and she doesn't care. That's on one side of the equation. There are other people who are very private and do not want any of their health information to be shared anywhere, even with all of their doctors. And so I think we have to respect patients' wishes where they are and meet them where they are. But that doesn't mean that we can't make it happen on both sides. So that's why, for example, in the ecosystem, we put in the certification process so that patients could see that these apps have gone through a privacy and security certification, because we think we need to start building that trust with patients that these are tools that have gone through that compared to ones that have not. So I think the biggest thing is, again, back to trust. I think providers need to know that it's actually that patient who's asking for their data. They need to know that it's actually that provider who authorized the request for data. They need to know what the payer is going to use the data for and if they're okay sharing that under the different rules. And so I think the more you can build trust in the process, the more the caution starts to realign. And I think the biggest change is to put the patient story there. As you said earlier, it's very hard to argue when you're talking about real people, real stories, real problems that happen. And when you tell the patient story, I think the stories are what change the world.
So, listening to you talk about big systems, building trust, and working inside organizations that don't always move so quickly, it's clear this isn't abstract for you. What's the clearest signal that care is on track and that the change is set to stay?
I think once patients get access to this information and these modern tools and have the power to use it, then I think there is no stopping any of this work at that point, because patients are going to push this harder and harder. I think ChatGPT said that they have 250 million people doing health queries a week. Once you have that kind of volume and people demanding access to their information and tools that work like the rest of your life, there's a comedian that talks about he'll trust doctors when he stops getting a clipboard to fill out and remember all of his information. And I can't agree more.
And we remember that we're all patients, right? I've been in healthcare for my entire life. We all have stories. This is moving very fast, faster than I've ever seen in my career. And I'm just hopeful. I said this to a group last week. Like, I'm just hopeful that this speed means we're actually going to make a major impact on patients very soon. So a lot of the work that you're leading is helping do that. So thank you for your leadership. As we wrap up, I just want to reiterate how directly your experience as a caregiver for your daughter connects to the work you're leading now. Yes, the scale's bigger, the systems are massive, but I think the basic test for success is the same. The care moves faster, gets smarter, and feels more human. What is your better way in healthcare? What's the experience of the future that you want to see, hopefully in the near future, for patients and their family?
Yes, I think the better way is that a patient seeks care in the way that they would like to seek care, and their medical story is already there. Nobody has to re-explain it. Nobody has to fax or spend time waiting on the data. And the patient gets to just be the person, or the mom in my case, and just experience it, not be the switchboard. I think that is the biggest thing, is to be able to help people get access when they need it, in the way they need it, without having to try to go dig up information and retell their story.
Amy, thank you so much for sharing your story and the work you're leading now. It's clear this, isn't abstract, and the changes that you're leading all somehow seem possible. So it was a pleasure having you on the show.
Thank you so much.
Amy's personal story about the systemic challenges she faced in caring for her daughter is compelling. And what's amazing is that Amy's experience did not turn into cynicism. She has channeled it into national scale change. 800 companies, a Slack channel, a July 4th deadline to free the data that coincides with our nation's 250th birthday. Here are a few takeaways from today's conversation as I see it. First, there's Amy's time frame around risk-taking. We've spent decades being afraid of what could go wrong if we share the data. Some risk aversion is absolutely necessary when it comes to patients and their information. But Amy asks us to also count what goes wrong when we don't share data appropriately. What can go wrong is urgent appointments canceled because records or results didn't arrive. What can go wrong is diagnoses delayed for months or even years. That's not caution, it's harm. So the goal is data that follows you, the patient, in one place and in a format that works for you when you need it. Second, there's Amy's position that we have a trust problem, not a tech problem. Because we have the technology, we have the tools. We've had them for a while now. Are we willing to trust each other enough to use them for patients? Third, I walked away from this conversation more hopeful than I've been in years. The momentum and urgency are both very real, and patients aren't waiting anymore. So if you want to be part of the solution, Amy has one specific ask. Google CMS Health Tech Ecosystem, fill out the form, and join the Slack channel. There's a seat at the table for everyone. Thank you so much for listening to There's a Better Way.
Thank you for listening in today. If you've enjoyed this podcast, please rate, subscribe, and review There's a Better Way, smart talk on healthcare and technology. With your help, we'll be able to continue to bring great conversations to the fore and to the wider listening public. Thank you.